Good morning. Can you see me?
Yes. Good morning.
Hi, how are you? I
Good
am so
morning.
sorry. Good morning. I'm so sorry about the glitches. I actually panicked when I sat down on my computer. All of a sudden, my Zoom got uninstalled. So I had to reinstall it, and I'm not actually techie savvy, you know. I welcome all of you to, I think this is my 6th webinar, and I'm still not an expert savvy with regards to this. So like any one of us, we always have a yearning. As long as we have the yearning to learn, nothing's gonna stop us. Nothing's gonna stop me to share this morning my passion. And that is the reason why I'm so thankful that for those who have continued to follow me. I know it's a Friday weekday. Thank you for joining me in the middle of the day. And for those who have joined me for the first time, I do welcome you. And I hope that today will be a start of our partnering, our journey together as partners as we continue my passion, my advocacy to increase awareness, not only in women's health, but in generalized overall wellness. Okay, let me start sharing. Let me start sharing the screen again. Here we go. Before that, may I ask everyone to mute themselves, please? Okay. Okay, this still doesn't want to go. Let me see. Oh dear. Okay, hold on. Okay. Adele, I am getting lost. I am sorry again. Okay, hold on. All right. Okay, we're back in business. All right. This morning, I would like to share with you the secrets to be happy. I have been sharing secrets to personal sustainability, secrets to a healthy V's. Today is actually a series, a sequel to my first VChat series on how healthy your V's are. So I welcome you again to share with you the secrets to be happy. But more importantly, I would like to share with you what brought us here in our gathering this afternoon. I would like to share with you, there we go again. Why am I not sharing it right, Adele? I'm sorry, there's something going on here. Wait, let me see. Hi, can you see my slides? Can you see my slides now?
Yes.
So I don't know what's going on. I'm sorry. Okay. Okay, basic, advanced, version, share. Stop share. So you're sharing now. Let me check. Okay. These webinars are actually hosted and brought to you by the Aherrera Wellness Group. I would like to tell you that this was actually established in 2018 as my personal advocacy to actually put women's health actually at center stage. It was at this time when I was just finishing my MBA at the Ateneo Graduate School of Business. And I took this when I was 57 years old. And I wanted to do something for myself, like giving back. And so I established this with just a vision to reach out to heighten awareness about the many intricacies, concerns that a woman goes through, it experiences, its stories, which involves not only good physical and mental health, but basically to come up with a revitalized and a renewed spirit. In a way, I had wanted actually to empower women in my small way. And so this is where I established it in 2018. But it was paused for a while during the COVID, the pandemic, until I revived it when my daughter, youngest daughter, was diagnosed with breast cancer. And that was when I started feeling that it was about time that women should not only think of other things about the cholesterol, but all these things that think they're healthy, but they really have to come up and look at themselves as a whole. And so I invite you to be a partner with me as we go through this advocacy of mine. And hopefully, Because a lot of women out there, in fact, I know some of you are fearful, some of you are embarrassed, or maybe you just simply ignore the existence of our wellness. Maybe, hopefully, by the webinars that I actually present, will provide life-altering choices so that we can promote a better quality of life and achieve a wholesome, liberating feeling of wellness. So today's objective, okay, is for each one of us to acquire a knowledge of the intimate issues, changes that help us achieve a wholesome understanding of feeling good and eventually achieve happiness. Now, let us all remember this lesson. If no one is willing to learn, no one can help you. However, if you are determined to learn something new, no one will stop you from learning. So let us make this our mantra as we partner together to find out how we can inspire and empower each other. Today, a lot of us face so many challenges, obstacles, and hurdles in achieving health and wellness and happiness. These are three strong words I'd like you to come out of this webinar, knowing and fully understanding that we all need our health, we all need to achieve wellness, and optimally, we need to reach out and seek our own happiness. But first, let's define the words so henceforth we will know the difference. Health and wellness are terms that are interchangeable, but they have different meanings. The primary difference between health is that health is a goal, while wellness is the active process of achieving health. The WHO definition of health states, you are in a state of complete physical, mental, and social well-being when you are healthy. It is not achieved simply by the absence of a disease or an infirmity. So the definition requires that a person must have both physical health and mental health to be considered healthy. You can say, yeah, I regularly exercise, I have a healthy lifestyle, I don't smoke, I don't drink, but you have depression, you are anxious, you have other mental illnesses. That is not healthy. When you have a poor mental health, that it lowers your overall health status. On the other hand, what does definition of health includes? It includes social well-being for optimal health, the importance of relationships when it comes to good health. So it encompasses physical, mental, and social well-being. Let's go into relationships. How is your relationship with you, yourself? That is a question that you will answer later on. Now, what about the definition of wellness? Wellness is the active pursuit of activities, choices, and lifestyle that will lead you to a state of holistic health. So wellness isn't just about passively waiting for optimal health to come in, because you actively pursue lifestyle changes, self-care practices, and in so doing, you encompass all the areas of your life, which include an overall balance of a person's, your physical, social, spiritual, emotional, intellectual, environmental, and occupational well-being. So you have health is your goal, wellness is your active pursuit of the following. My last webinar talked about personal sustainability. I will briefly talk about the self-care practices with the different dimensions that will lead to your overall wellness. Let us begin with physical wellness. To be physically healthy, you have to move. Move often. 30-minute movement like walking or maybe jogging 3 to 4 times a week is physically leading you to your wellness. Apart from that, those people who enjoy going to the gym, another 30-minute movement is also acceptable. To be physically healthy, you need to eat well. Now, I always tell my friends and my patients, you don't have to look far. How big is a serving do you need to keep healthy? Just look at your palm. Your palm will be your serving. All you need is 4 to 5 servings of fruits and vegetables in a day as an acceptable diet that will include in your wellness and sustainability. Apart from that, this is my favorite picture. I couldn't find a picture of women, but instead I saw a picture of men. Intermittent fasting is a craze that everybody goes through, but not knowing that we don't need to do that. We just need to remember. Look at these gentlemen. Remember, the 3 meals a day are important. It is the portion of food that will be associated with weight loss. It is not the timing. Remember that your breakfast will be your biggest and your fullest meal. You need to remember the 3H while you eat your meals. Breakfast time, you eat heartily with gusto. Then lunchtime, you eat healthily like a princess. During dinner time, you eat hardly. So it's heartily, healthily, and hardly. Then your last meal would be at 7 p.m. Then you sleep it through. That's why it is called break fast. You break the fast overnight. So remember, eat heartily during breakfast, healthily during lunch, half of the portion of what you ate the breakfast time, and hardly eating during dinner, and then sleep it through. The third part of your physical wellness will be sleep. The acceptable number of hours during the day, during the night, is 6 to 7 hours. Less than 5 or more than 7 might be a little, it would disrupt your circadian rhythm, that which is responsible for your sleep and wake schedule. It is important to establish a routine sleep and wake schedule. Why? Because the melatonin that helps induce your sleep is affected by what? Your cell phones, your electronic devices that produce the blue light that delays the release of your sleep-inducing melatonin. Another thing, do not try to sleep when you are not sleepy, because this will cause you to be an insomniac. So for those insomniacs out there, you need to establish a winding down routine. That would mean reading a book or do your facial massages, or you could actually just lie and listen to relaxing music. Suffice to share with you that each of us actually has an average sleep cycle a night of 4 to 5 cycles a night, which means an average sleep cycle is about 90 minutes. And each sleep cycle has 4 stages. And the biggest and the most important sleep stage is the deep sleep, where you're fully rested and you're fully away from the earthly conditions. So remember, the 3 physical wellness self-practices would be move always, eat healthily, and sleep properly. Next, let us go to the environmental wellness. Living in a hazard-free environment adds to your health. The goal is to occupy a pleasant, stimulating environment that will support your well-being. That means spending time outdoors and enjoy the world around you. That is spending time in the green space. That actually leads to, if there's such a thing as sunbathing, there is such a thing as nature bathing. Enjoy the green space, enjoy God's creation, enjoy the sunrise and the sunset. All these not only lead to your physical health, but also to your spiritual health. Emotional and social wellness, both of which promote happiness and positive health outcomes. Emotional wellness is our ability to express and accept our own feelings, the same for others, while social wellness is the interaction and connection that we have around the world, around the world and around the people around us. How you view yourself is a relational aspect of your life. And these emotional and social links to long life, increasing productivity, increase self-esteem, and improving your immune system. Remember, relationships are important. And the most important and the most lasting relationship is with family. Building resilience, building positive family relationships are built on communication, teamwork, and appreciation of each other. Next, occupational and intelligence wellness. Finding work that gives you personal satisfaction and a purpose will increase your wellness. As I speak to you, my dear friends out there, this gives me not only a personal satisfaction, but it gives me a more purposeful life because I enjoy talking, I enjoy sharing, and this not only leads to my practice in obstetrics, but it leads me to an occupational wellness where I can contribute to the community. So, occupational wellness is encouraging someone to share your passion, while intellectual wellness means you are sharing the knowledge, you are contributing to your abilities to your workplace or to any organization that will build and help a community. Now, what about mental wellness? I am sure a lot of you will say, oh, mental wellness. That means you don't have any mental illness. Actually, WHO definition of mental wellness is being in a state of well-being in which you as an individual, you'll realize that your own abilities, you can actually achieve 3 things. You cope with the normal stresses that you encounter in your daily life. Second, despite these stresses, you can work productively and fruitfully. And third, you're able to contribute to a community. So there you have all these But remembering that wellness actually has a direct influence on holistic health. What is holistic health? This emphasizes the connection of your mind, body, and spirit. Holistic health is an approach to life where you not only focus on an illness or a specific part of your body, but it considers the whole person on how he or she will interact with your environment. So at its core, health, again, is the status of your well-being, while wellness awaits you because you actively pursue a healthier well-being. Furthermore, it is important that wellness will strive for that balance that you always try to look for by making choices to further your health and your fulfillment. And at the same time, because of this, you end up into an optimal state of happiness. Understanding that happiness is an aspect of wellness. It is a constant work in progress. Happiness is when what you think, what you say, and what you do is in harmony. So I've defined to you health, wellness, and happiness. So what is a connection now with this afternoon's lecture? Remember that happiness is a mental and emotional state of well-being defined by positive emotions of contentment and intense joy. Look at this slide. What does it say? You actually have to throw away all the medicines that you take. You know why? Because happiness is the only medicine that will lead to good health. So it's time to be happy. Remember that happiness is a reflection of your health. The groundwork of your happiness is health, and therefore happiness and health go together. There is no true health without happiness. Happiness is therefore the highest form of health. So when I see you out there, I want you to be happy. Happiness will tell me you are healthy. And so health and happiness begins with you. Remember that happiness is when our life fulfills our needs and not our wants, and makes us feel satisfied and content. And so now that it begins with you, allow me then, let us start your journey to a healthier and happier life. Health is happiness. Allow me to walk you through your healthier and happier V. After 30 years of my practice in obstetrics, dealing with delivering babies and dealing with women and their menstrual irregularities and concerns, with other issues of the reproductive system of the female, encompassing all the issues, concerns from each phase of a woman's life cycle, from infancy, youth, puberty, adolescence, adulthood, childbearing, pre, post-menopause, menopause, and the geriatric. Actually, I have come to realize that it's actually the women's intimate health and wellness that should be the top priority in the health list in the young and the young ones. Many have just totally ignored their intimate existence. I am not kidding. This is serious. And sadly, there are many who do not live to make their intimate existence healthy and happier. Today, I will openly discuss this emerging trend with no hold bars, with no pun, and no malice included. This is a woman's life cycle that each one goes through. I want you to identify where you are. And each phase carry a certain experience, a certain story. And each woman, therefore, must be mindful and fully understand the changes that it actually experienced through time and understand the complexities that it had actually affected her existence. What is your story? Only when one acquires again the knowledge of these intimate changes can we achieve a wholesome understanding of feeling well and feeling happy. So I'm here to share with you and hopefully women out there who suffer quietly or choose to be silent about it, come out courageously and seek help where and when possible. Now, why do I keep talking about intimate? Intimate is defined by Webster as something private, something personal, and closely associated with us. And what is that? What belongs to us that is so intimate? And this is referred to the V's in our body. How many of you out there know how many intimate V's that we have in our body existing? I won't be surprised if many of you are confused with the V's that you have in your bodies. We actually have two, and a little anatomy will help you better understand what these are. Incidentally, you can go through my VChat series, first series that was in December 2021, where I exhaustively talked about the healthy V's. And we will just today, I will just briefly talk about it. But if you want to understand it more fully, you can actually go through the Herrera Wellness Tube channel where you can view and listen to this lecture. So when you spread your thighs, you will actually see the first V, that is the vulva. The vulva is known collectively as the external genitalia, which separates us or a vital expression of our femininity. It defines us as a woman and our sexuality. And this intimate part below certainly belongs only to you and to me. Understand that the vulva plays a very important role in our capacity to reproduce from childhood to our childbearing years. And inevitably, like any body parts, it also winds down and it ages. And our ultimate V's are the most vulnerable when one ages because it does not hide the truth. So briefly, let me describe the vulva. Here you will have a mound of fat known as the mons pubis when lying or standing. On the sides, you will again see a mound of fat on both sides that are occupied by spars or coarse hairs. That is known as your labia majora or your outer lips. Hidden within your labia majora, you will find your labia minora or the inner lips. When you follow the inner lips, you will reach a certain structure in the midline known as the clitoris, which is rich in nerves and is partially hidden by a clitoral hood or tissue, okay, similar to the foreskin in males. This area, again, is rich in nerve tissue and is suited for sexual satisfaction. Again, if you further the structures of the vulva in the midline, you will find a pinpoint opening known as the urethra that is actually the urinary opening where urine is excreted. Further down in a midline structure, down below your urinary opening, is your vaginal opening. That is your vaginal introitus. Okay. This whole thing is not the vagina. This vaginal opening leads to your vagina. I will talk about that in a while. Okay, so this is your labia majora, labia minora. An important structure in the vulva is what is known as the perineum, that is actually occupied by a lot of muscles because it provides the muscular support of your vaginal canal and acts as a barrier protection between your vaginal opening and your anus. So that briefly is your first V. Your first V is your vulva. Understanding that the vulva, again, is not the vagina. The vagina is your second V. It is actually a muscular canal that is found internally, connected only to the outside of the body through that vaginal opening, which you have seen externally. Understanding that the vagina has important roles in sexual behavior, menstruation, because it is an outflow tract where menstrual blood flows out, and childbirth, because this is responsible, or it facilitates childbirth via the vaginal route. So you will need a vaginal opening and you will need a vaginal canal to ensure that these roles are effective and healthy. Now, my question to you out there, how does one know that your intimate Vs are happy? How does one show her happiness? Have you ever wondered how your intimate V show your happiness? What do you see is common to all of these? Happiness is manifested generally in our faces. When we have nice smiles, that which are affectionate, friendly, innocent, bright, energetic, charming, cheerful, radiant, warm, but more importantly, with glowing eyes. So to better understand the happiness experienced by our intimate Vs, we must remember that we, all women, have two faces. So if your face is happy, it should show that your intimate V is also happy. Because the intimate V that is happy is manifested in your face and in your eyes. Okay, look at this slide. This is your face down there, your intimate face down there. And this is your face that you show to the world, proudly showing them off your beautiful smile. Unfortunately, our intimate face below do not have eyes. But our eyes in our beautiful face up there are the mirrors of, or the windows of our soul. So if your eyes are glowing, we know that you are a happy soul and a happy spirit. And it should also follow that your intimate V should also be happy. How? Look at this. This is your face below and this is your face up there. Your labia majora is parallel to your cheeks. While I speak, it is best for you to understand and probably feel your cheeks so you will visualize and understand you are also feeling the cheeks of your vulva. So your outer lips are your labia majora likened to your cheeks. Your inner lips, they do not, your inner lips is actually the crease between your cheek and the base of your nose. Take note, it's just a crease. There are no flaps flapping over your cheeks. The same way, your face below should not have any of those excess skin flapping over your outer lips. Next, go through the midline structure of your face. The bridge of your nose would be your clitoris. The tip of your nose would be your urinary opening, and your mouth with your vagina. Those are the midline structures. Now, remember the chin is also important. The chin is likened to your perineum. Remember what I said, the perineum is actually, it provides muscular support for the vaginal canal, and it provides a protection between the vaginal opening and your anal opening. And therefore, feel your chin. Your chin should also separate your mouth from your neck, which is actually the anal part. So you will understand better and feel for yourself how your face looks down there. Here, I would like to show you a youthful vulva. We all had this many decades ago. This is an example of a normal youthful vulva. No creases, no wrinkles on the sides, no discoloration, pink structures, symmetrical, no excess folds. You can see the well-delineated basic structures. You will see the clitoris, the urinary opening, and the vaginal opening. And you will also see the perineum, which is the area outside the vaginal opening and the anal opening. What am I trying to show you? That the vulva and the vagina existed this way when we were young. However, another V came into place and came into existence. That is V, that stands for vulnerability. The vulva and the vagina are vulnerable structures in our body. And it is the least discussed, the least talked about, but it is the most vulnerable when our body clock winds down and our body starts to age. Look at this picture of a woman. She will go through great lengths just to make her upper face look younger while she starts aging, and not realizing that the other face below, intimately below, is lagging behind. As you age, understand that your intimate face will manifest unhappiness, even if your upper face show its happiness, with all those beauty products, with all those beauty machines that will keep you young, because the intimate V can never hide the truth. That is truth to tell. And interestingly, here are pictures that I would like to show you of the different appearances, sizes of the vulvar parts of women from different age groups that moves from one phase in their life to another. you will understand that the basic structures are there. Labia majora, labia minora, the midline structures. However, these patients actually have a visually self-perceived unattractiveness or some form of pain or discomfort that have nagged them for years and therefore allowed them to seek consultation to find alternative solutions that did not appear just overnight. Luckily, if there is such a thing as aesthetic surgery for the body, face, abdomen, and other female body parts, aesthetic gynecology is a surgery of the intimate female body part. I would like to stay away from the word surgery. It is actually a science of the most intimate makeover because it involves not just surgery, but non-surgical medical treatments in cases where your intimate V's have already been affected by the aging process. Aesthetic gynecology is for women who want a well-balanced life. Empower them with knowledge, choices, and healthy alternatives when it comes to your intimate health and your wellness. Remember, this is not a myth. This is not a whim. As people would say, ay, pampaganda lang niya. No, it is not fake. There are plausible reasons why women have to come for an intimate makeover. Because of the option, the alternative for each one of us to look good, to feel sexually confident inside and out. And it is not just a makeover, as I told you. There is a healthy alternative. There is a basis. There is a science that will address the physical, the anatomic, the functional aspect of your intimate V's that will result in the restoration, renewal, and the revival. I would like to call this the V restore procedures or treatments that are safe, painless, medical, effective solution for addressing any of the intimate concerns that I will talk to you about this afternoon. The first of which is the natural process of aging. This affects the form, the structure that may result in vaginal dryness and vaginal tone. Your second intimate dysfunction is something that addresses a function that actually disrupts your daily activities. It affects the processes that you actually go through. The third is your aesthetic imperfections, that which affects the appearances, like other women who would come just to find out that there is something abnormal in them. Remember, these can happen to anyone. And therefore, we are here, I am here to help you understand what these are and how you can actually go through this wellness and your happiness. Let's start with the natural process of aging. Here you will see the aging vulva. It is dry, relatively dry looking. It hardly has any tone and complains of reduced vaginal secretion. Before we go through that further, I'd like to give you the three important factors or three important aspects that will lead to vaginal health. This should make us understand why the vagina goes through all these changes. The three factors that are important for vaginal health are number one, estrogen. This is your female hormone that nourishes our whole body from the time we started menstruating until such time that we stop menstruating. Okay. Your estrogen plays an important role in vaginal health as it, together with the lactobacilli that is currently and rich in naturally occurring quantities inside the vagina, together it provides an acidic environment which produces lactic acid that provides a natural barrier against infection, irritation, and therefore improves the optimal health of the vagina. So three factors: estrogen, the presence of your lactobacilli, and your acidic pH. Now, my talk will not be complete if I do not explain the next slide. Here you will see the pH of the vagina, of the women's vaginal area in different phases of their lives. So remember, estrogen is crucial. It actually appears during our reproductive years, and therefore in the newborn, the pH of the vagina is 4 to 5. Remember, the acidic pH of 3.8 to 4.2 is the normal vaginal pH in a childbearing woman, that which has a lot of estrogen in the body. Therefore, the child, a 7-year-old who is still not menstruating, together with a menopausal woman who has stopped menstruating or has absence of the estrogen, now will produce a vaginal pH that is higher than that of 3.8, which is 7. Okay? So what happens during this time? When the pH of the vagina is 7, now there is a lot of other bacteria that comes into the picture, and therefore you will be prone to infection, vaginal discharges, and therefore will need and to seek help in such cases. Unlike those women who are still under the influence of estrogen, you have an existing pH of 3.8 to 4.2, and therefore it can actually maintain your vaginal pH. However, what happens is that it is still important that despite all these changes, women are encouraged to go through intimate feminine washing to prevent any of these infections to set into the vagina. Okay, further, I would like you to show this slide. Okay, here you have your vaginal canal. Remember, your vaginal canal has life. It speaks and it talks and it acts independently from the other parts of the female body. Inside the vaginal canal is an ecosystem where you have existing estrogen lining or nourishing the vaginal cells. It provides a food substrate for the naturally occurring lactobacilli. In such way, biochemically, in this interaction, it results in lactic acid that produces a pH of 3.8 to 4.2. So these structures or these factors are important for optimal vaginal health. And therefore, if there is a lack of estrogen, if there is a lack of the good bacteria, where there is an improper or inappropriate vaginal pH, these may lead to vaginal inflammation, vaginal infection, and vaginal dryness. Additionally, I always ask my patients when they do their intimate washing to massage the cheeks of your vulva. You need to have a relationship with your vulva. It's time to do it now. You've ignored it. You've actually left it behind. So now is the time to soap the sides gently, like you are washing your face. Be gentle with your cheeks. Be gentle with your face. Have a relationship with your V's. Furthermore, for good vulvovaginal hygiene care, avoid irritating soaps, fabric softeners, avoid spraying perfumes, wear cotton panties, and keep the air dry and exposed. I always tell my patients, even my friends, stop using panty liners. Why do you like to cover your intimate face? Hindi na nga nakikita ng mundo. Tatakpan nyo pa with your panty liners. Furthermore, it has to be exposed. Okay? Putting those panty liners will actually keep it moist and will actually spread germs or bacteria coming from the anal area that will be spreading into your vaginal opening. Keep it moist. And you don't need those panty liners to press on those cheeks, those lovely cheeks. So enjoy and remove those panty liners. Save your money. Just change your underwear. If there are vaginal discharges, okay, change your underwear and seek your doctor and find out why you have those vaginal discharges. Next, as a woman moves into the circle of life, ito na. So we talked about estrogen, we talked about lactobacilli, we talked about the acidic pH. As a woman goes into the circle of life, what happens? There is now a decline in the hormone estrogen. And this decline will lead to vaginal dryness, vaginal itchiness, vaginal discomfort, urinary problems, discomfort in passing urine, frequency, urgency, and the burning sensation. Remember that your vaginal canal has a role in sexual behavior. Your vaginal dryness is secondary to a decline in your estrogen hormone. And when that happens, not only is there a decline in your female hormone, there is now a decline in the protein fibers of your skin, namely collagen and elastin, which provide support and elasticity of your vulvar structure and your vaginal structure. And so with the lack or the absence of your female hormone, together with the lack of all these protein fibers, it now will result in total vaginal dryness, less lubrication, okay? That will lead to a decline in sexual activity. The less lubrication will decrease your blood supply and blood flow, declining sexual activity, declining sexual drive, and therefore will lead to painful sex. It is important to have sex during menopausal phase because it will increase the blood flow within the vaginal canal. It will improve blood flow that will stimulate the dilatation of blood vessels, increasing moisture brought about by the sexual activity. The friction and the thrust will improve the following. However, for those who are in a state of single blessedness, you don't need to have sex. Vaginal dryness will really, there is no permanent cure for this. It will also affect you. And it may lead to what we call atrophic vaginitis, brought about by the imbalance of your vaginal pH. And therefore, this can be easily treated by giving you hormones, giving you probiotics, and therefore normalizing the pH. Medical treatment is number one in women who complain of vaginal dryness. Remember that. There is no need for any surgical intervention where vaginal dryness is concerned. It is the natural process of aging. And therefore, we need to address that lack or absence of hormones, which is estrogen. So the first line of treatment for the natural process of aging is menopause, is estrogen creams or vaginally inserted tablets, avoiding scratching, heat, and excessive sweats. Now, I want to emphasize, because there are women there who are in a state of single blessedness, you might say, hindi ko kailangan yan. I don't need sex. Yes, you don't need sex. That is correct. But you will need to understand that you will encounter vaginal dryness. You will encounter vaginal itchiness. You will encounter what most of my patients encounter, which is the burning sensation. You just feel that there's something there. Something is not right. This is an example of a patient who came to me for continuous negative results of her urinalysis. She says that there's something not right. So she always undergoes a urine test. But the urine test doesn't show anything, doesn't show an infection. Yes, because of the anatomic change in your vulvar opening. Here you will see the vaginal introitus is pale looking. When you see that it is pale looking, this means that there is a lack of blood supply. There is a need to increase and improve the blood flow into this area. And this is one plausible reason why a lot of women would come with a urine test that is negative for a WBC count, no infection, but will present sometimes with red blood cells microscopically in the urinalysis result. And they will complain to you of, they just feel dry. Remember, they didn't have sex. They just feel dry. In fact, they even have this discomfort, a urinary discomfort, or discomfort in the hypogastrium. This, if you will look closely, is an example of a vulvar atrophic, a vaginal atrophic introitus. Now, after treatment with estrogen cream, look what happens now. It's no longer as pale as it used to be. It has now become pink, almost youthful. Pink color means it is alive. There's blood flowing, correct? If it's pale, it's dead. Maputla siya. But if it's pale, if it's pink, it's alive, it's fresh. So remember that for those women out there who are in the state of single blessedness, you just don't need sex. You need just a treatment, but you need to understand what are the changes that are happening to you. So I did explain that it is not just the female hormone that is becoming deficient as we age. It is also the two important factors of the skin protein fibers that lead, that give us, that cause the foundation of our skin structure. And these are collagen, and these are elastin. Look at the left side. These are the younger skin. Look how your collagen fibers form the structural framework of your skin. Your elastin fibers are in between your collagen fibers, and your elastin fibers are responsible for the elasticity of your skin. And the aging skin on your right-hand side will show that there is a disruption in the elastin and your collagen fibers. And therefore, what happens? It no longer snaps back. It no longer is elastic. Understand that your collagen and elastin creates the strength, the firmness, and the shape of your vulva. And when aging comes in, it is depleting these two factors, resulting in a tired and exhausted vulva. Look at this. You see how tired it is? Pagod na siya. I wonder how this looked when it was youthful. But now that it has aged, the lack or the absence of these proteins, namely collagen and elastin, had everything to do with a weaker framework, loss of structure and firmness, allowing now the skin to bend forward, sag, cave in, and therefore, since there are no longer elastin fibers, it no longer snaps back to its original position, and therefore it looks like it's just about to fall apart. It is important to understand that these creases, these wrinkles become anidus, where bacteria and fungal infections start setting in. That's why many women would come for vulvar itchiness, vulvar dryness. That is because your collagen and your elastin fibers are now depleted and it has caved in. And all of these creases will start showing some form of infection, mostly fungal infection. However, you just can't be applying, remember, estrogen here, because the problem is not just the absence of estrogen. The problem here are your fibers of the skin. So what are the possible healthy alternatives that we can actually consider, that we can probably be made aware of, that will at least fill the gap between what was young and what is now? So we have what we call the non-surgical V restorative procedures. Women may not need surgical intervention, remember that. But this is only because it was brought about by the natural process of aging. There is a possible solution and alternative called a temperature-controlled radiofrequency procedure. It is a first non-invasive, non-surgical, painless, restorative procedure that relieves the symptoms of female genital conditions. It is pain-free. It revives and restores the loose, sagging, labial skin, dry vulva, dry vagina, loose mucosa, loss of sensitivity, okay? For women who do not only suffer from a functional or aesthetic concern, but from the process of aging. What it can actually do is to achieve a youthful look, but it has other restorative effects. Remember, it deals with dry skin, loose skin, and insensitive skin. This is Dr. Red Alinsod, who is a Filipino, a urogynecologist from Laguna Beach, California. He is the one who developed and pioneered this technique. It was in early 2017 that I had the chance to train under him as he shared his expertise with regards to vulvovaginal restorative procedures, especially in those who are dealing with the natural process of aging. What is this procedure? Okay, I always deal with the science. I don't like to deal with a whim, and I don't like to deal with just something fake. I need to have a science, and this is a science of heat, not laser, because you use heat to tighten and to smoothen the skin. An example, if you don't use your arm for a while, what happens? Or to your muscle? It gets numb, namamanhid. Okay? So what do you do to make it run and to make it live again? You rub heat. Don't you rub heat on that? Because rubbing heat will actually improve the blood flow. That is exactly what it will do. Radio frequency or heat is delivered deep into the tissues that need addressing, that need smoothening or need tightening. And it is massaged by I wasn't able to show you it's a probe, okay, that can be used outside and inside the vagina. It's a delicate S-shaped piece of a handpiece. It increases the blood flow again to the impaired tissues. So it now stimulates new and tighter collagen, okay, improving the blood flow. And inside the vagina, it tightens and thickens to improve moisture, lubrication, and friction during intercourse. I will show you the slide. Here you will see the RF tightening of the skin and stimulating new and tighter collagen remodeling by increasing blood flow after 1 treatment, 2 treatments, and 3 treatments. So you have one probe that is used outside and another that is used inside the vagina that will thicken and tighten the vaginal canal to improve moisture and friction. The whole procedure is 20 to 30 minutes, okay? On 10 minutes on the vulva and 10 minutes, 20 to 30 minutes, 10 to 15 minutes on the vulvar area, 10 to 15 minutes in the vaginal area. Recommended treatments are 3 sessions, 1 month apart, maintenance 6 months or yearly. During the day of the treatment, the patient is brought to a comfortable private room. There are no extensive pre-procedural treatments, no pain, no medications, no anesthesia. Side effect and downtime is none. You can actually resume normal activities, including exercise, swimming, and sexual intercourse. Here you will see how Thermiva is done, how it actually will improve your intimate V. Before slide shows you the skin to be wrinkled, caved in, bent in, and sagging. Immediately after the first treatment, you will see an improvement because now there is tightening of the skin, causing the contractility of your collagen fibers. You will see now it is puffed up. The creases are beginning to loosen up and no longer visible. It is on the second RF where now you no longer just have a new and tightening collagen fibers, but you also have the elastin fibers that are now being established because you can see that it can now tighten, the skin goes back to shape because of the presence of your elastin fibers. And the last but not the least, after the third RF, there is a tighter and younger looking skin. The skin folds disappear. Elastin allows the skin to go back to shape, and there is strength, firmness, and shape. Patients who may benefit from this treatment may commonly have one of the following: experience looseness or laxity from pregnancy and childbirth, may wish to improve their leaky bladder from urinary stress incontinence, or you may want to improve or reduce the vaginal dryness apart from your vaginal medical treatment, or the loss of vaginal tone from the aging process after menopause, or simply would like a youthful or refreshed appearance of their V's. Your restorative effects of RF on vulvovaginal laxity can reverse some of the changes resulting from childbirth. Remember, your RF can only tighten vulvar laxity, which surgical procedures cannot tighten. Surgical procedures cannot tighten your vulva, cannot make it look tight, but your RF can. Patients who don't want surgery, but just want to treat their functional or perceived abnormality, meaning to say you don't want any treatment with regards to the laxity of your vulva, you can just go ahead and just take a youthful look, and this will be the restorative effect of their vulvar laxity. Restorative effects of RF for vaginal discomfort and dryness truly is exceptional because it can treat irritation, burning sensation, itchiness, and general soreness. Traditionally, yes, we treat, as I told you, first-line treatment would be your estrogen cream. But sometimes you cannot just use this all the time. So you have an alternative option to use to alleviate the symptoms as a supplement treatment. RF is unacceptable and good for women with breast cancer or those with gynecologic cancer, those experiencing early menopause because of their treatment. Okay? Because remember, this is not hormonal treatment. This is a treatment for the collagen and elastin, your skin treatment. It is also providing restorative effects of urinary incontinence. This works well. I am not saying that this is the cure for urinary incontinence. No, it can provide as an alternative, especially in women who are high risk for surgery, but would want adjuvant or optional treatments apart from their estrogen and probiotic treatments. We are not saying that RF will totally reduce, it will totally remove the frequency of your visits to the toilet at night, but it will certainly reduce the number of times you will go to the toilet at night. The other restorative effects of RF is sexual satisfaction. Yes, intimacy is crucial to keep deep and lasting relationships, especially when it enhances one's sexuality. Sexual or orgasmic dysfunction are not often verbally expressed. However, women, I have one or two women who just came just for the satisfaction, the lack of the arousal has improved the blood flow around the clitoral area with RF, and it is expressed by increased stimulation and enhancement. Okay, so now I dealt with the intimate dysfunction that is caused by the natural process of aging. But what about the functional impairment? Functional impairment is largely caused by an anatomic or organic reason, resulting in a vaginal relaxation, looseness. Look at the vaginal opening. you can see how lax and how stretched out the vaginal canal is. And therefore, this results in involuntary passage of urine upon coughing, laughing, sneezing, or straining. So vaginal laxity and looseness results from pregnancy and childbirth. This is a condition where there is a loss of the optimal structures of the vagina. They're stretched, they're so lax, so the internal and internal diameters increase, and therefore the muscles of the perineum are weak and poorly supported. And so patients complain of stress, urinary incontinence. A change in their bowel function means sometimes they're constipated or not even they are constipated, not able to move their bowels regularly because the vaginal canal is so lax and the perineum, the muscle support has also been stretched out. So, and another is the feeling of looseness and less sensation during intimacy. To address this, we will need surgical intervention. Another intimate dysfunction that may be addressed would be aesthetic imperfections. Now, in my aesthetic gynecologic practice of more than a decade, the demand for this surgery appears, take note, it's not function, it's not aging, it appears on some need of the woman, of the patient, wanting to correct a perceived abnormality, like hypertrophy, that means excessive, extensive stretch of the labia minora, a sagging vulvar labial skin, or a discoloration of the labia minora. Okay, so these are aesthetic imperfections that are self-perceived, unattractiveness, and discomfort that have nagged them for many years. Suffice to say, this does not only happen in the childbearing, young adults, menopause, perimenopause. Surprisingly, here you have a 10-year-old non-pubertal, when you say non-pubertal, has not menstruated, but brought in by her mother, who saw that her vulva, her genitalia was not normal. So this is an example of aesthetic imperfection. We leave it as is, but suffice to say that this exists. So again, I will show you this picture of the number of women who come for all other reasons, but 80 to 90% seek consult and surgery for a perceived need, like a gaping vaginal introitus. If you look at that, sabihin mo, yan lang, may reklamo na, that small incident or that small episode, but she has a story to say. She has a story to tell. So she wanted it for herself. Another, there are patients who come for irritating or surgery for irritation of vaginal discharges because of the anatomic association of the butt into the vaginal canal. It has lost the muscular support of the perineum. So if this is the face, nawawala na ang chin. The chin now starts receding. Next, here you have another woman coming in for a gaping vaginal introitus, excessive vaginal discharges, and poor control. So this is not only an aesthetic impairment on her part, but also a functional impairment. It bothers her to have all these discharges affecting and always seeing it in her underwear. And the last, it is not only a perceived need because of a perceived abnormality, but it's because she is embarrassed to face her husband. All this did not appear overnight, but functional and aesthetic reasons our patients' motivations to seek alternative solutions, to make them feel good, to make them feel confident, and to make them feel happy. So let me show you other childbearing vulvas. Here you have an 18-year-old who comes because of stretching, pain from her labia minora. Next, you will have a woman because of the aging process and childbirth process. The vulvar skin starts to sag and start to get lax, causing some pressure on her front. Here again, here, this is an example of a woman, 44-year-old, in a state of single blessedness. You will think that all this can happen because of childbirth. No, this is a patient in a state of single blessedness who comes because of this abnormality. So what then are the vaginal restorative procedures? At the outset, let me stress that most of you have heard of these: laser vaginal rejuvenation, designer laser vaginoplasty. Please bear in mind, these are not procedures. These are just marketing terms that are being used to describe the surgeries to address these aesthetic or functional impairments. And this is actually marketed and trademarked by no other than Dr. David Matlock. I'm sorry, I cannot make the light any lighter. That is how he looks. It was in 2007 that I had the opportunity to train under him, where he started empowering women. At the time in our country, we were still so prude and timid about vaginal restoration, vaginal rejuvenation. Okay, but suffice to say, after 15 years, now I can openly talk about it without being embarrassed or being intimidated, because it is true. He empowered women way back, almost 2 decades ago, but he used a laser pencil to cut, dissect, tighten, and to tighten the vulvovaginal tissues. He used the principle of plastic surgery, of attaining symmetry, all the structures in the midline that would be clean and precise. Again, to result in form, function, and appearance. Remember what I said: form, aesthetic imperfection; function, what are the functional impairments; appearance, okay, because of aging, what has it done? So procedures, okay, surgical procedures, for all intents and purposes, we will call them V restorative surgical procedures. Now, again, for a recall, these again are your normal youthful vulva. Take note: no excess tissue, no wrinkles, no creases, pink in color. So it has the form, it has function, and it has the appearance. Okay. So what are the procedures that can be done to help women in their concerns? I will begin with labial reduction or labiaplasty. Here is a 17-year-old who complained of pain due to the pulling and stretching of the excessive labia minora. After the procedure, this is how it appears. 6 weeks after the procedure, it now looks youthful, functional, and more importantly, aesthetic pleasing to the young lady. Next is my 19-year-old adolescent advocate. She was brought in by her mother, who went to 3 doctors who couldn't offer a solution and told her that's part of life, that she has to go on dealing with it. But after a few months, okay, She finally was able to get some solution. Her complaint was a discomfort. Of course, look at your labia minora. It's pulled out. It's stretched out this is actually stretched out several times. She could hardly tuck this in, excess skin underneath her underwear. So she started feeling low. She started feeling losing her self-confidence. And after her procedure, this is how it appears. Again, we go back to the basic structure, labia majora, minora, and then your midline structures. And 6 weeks after, she is a pleasing young adult who has been advocating for the young adults who have similar issues and inspiring and empowering them not to be embarrassed and to seek help when necessary. Here again is a woman, a 28-year-old lady who complains of pressure in her front. Take note, apart from her labial hypertrophy, her vulvar structure now has become too wrinkled and has become excessively dry because of the excessive pulling of those tissues in the midline. So she underwent the procedure. Now you no longer will see excessive tissue, but yes, we don't see the wrinkles. 6 weeks, 5 weeks post-operatively, she underwent, an RF procedure to tighten her vulvar structures. She is now beaming with confidence and all smiles. So her intimate V was manifested by her beautiful young smile and face. Unfortunately, I cannot show you how beautiful she is, but you have to trust me. She is beautiful. She went back to work after 3 days of her operation. My latest and most recent patient, 18-year-old woman or young lady, complains of urinary frequency. Okay, this is another example. It was not a perceived unattractiveness, but she came brought in by her mother because of frequent urinary complaints, negative urinary results, no UTI. But why is it that she always has this complaint of pain in that area? If you will look closely, her labia minora is not really excessive all the way down up to the perineal area. It is only halfway her vulva. Preoperatively, you can see, if I stretch out the labia minora, you can see that the lips, when they are pulled in together, they press on the urinary opening. Remember the midline structure of your clitoris, your urinary opening, and your vagina, okay? So with preoperative, I was able to show you the tissues that we need to remove, and post-operatively, this is now how it appears. I still have to see if there is still pressure or no obstruction on the urine opening. The proof of the pudding is when she no longer complains of urinary frequency. Another procedure known as the reduction of clitoral hood, where you have, due to aging and childbirth, you have sagging of all these tissues, feeling of heaviness in the intimate part, and showing some, and manifesting some pain and discomfort. Okay. So this woman underwent this procedure you call the reduction of your clitoral hood, and 6 weeks post-op, this is how it is. At this juncture, it is important to be mindful of our intimate part. You need to take notice of it now. Don't let it cry. Let it cry. Don't let it cry, because right now it might be crying for help. Perineoplasty is another procedure that is done only for a surgical correction of the chin to provide muscle or muscular support for the vaginal canal. It will just elevate the perineum, and the pelvic floor. So it can be both a functional, it will address your functional impairment, and can also result in an aesthetically pleasing vulva. Now, there are cases where you can do a combination of all these procedures. A case in point is a patient, 44-year-old, 8 pregnancies, 8 vaginal birth pregnancies, who was brought in by her husband from Dubai, who wanted to have her vagina tightened. But I did explain to her, see, take note. The husband just noticed that it was just loose, but the husband was not even aware of the vulvar structures and the features of how the vulva should actually look. But when I explained it to both husband and wife, they agreed to have a labiaplasty, removal of this excess skin, removal of those excess prepuce, together with a vaginoplasty, meaning to say, addressing the inner, the upper and the outer vaginal walls. And this is how it looks. It looks youthful. You now have the basic structure of your labia majora. Your labia minora no longer sticks out into your labia majora. You have your vulvar structures, the clitoris covered by your clitoral hood, your urinary opening, which found within your vaginal opening. Both husband and wife are pleased with results. So both are happy, intimately and externally happy. Another is a patient of mine, a 42-year-old, 2 pregnancies, 2 vaginal deliveries. A patient from Palau who came to Manila just for these procedures. She consulted online and virtually, expressed the lack of confidence and the loss of self-esteem. She stayed in Manila for 7 days. Instructions were given way before her scheduled arrival, that before she had that procedure. After 7 days, she flew back. This is what I did. So again, you cannot now differentiate where her labia minora is. You will actually see that everything is excessive on both sides. Your labia minora and your excess prepuce here. Post-operatively, this is how it appears. Now you can see well-defined labia majora, the minora, and your midline structures. She now claims, oh, by the way, this is an example of a woman, typical woman seeking and finding her happiness. She was in a state of single blessedness. After 8 weeks, she sent me this picture. She now claims that she has a new boyfriend and not only found her intimate happiness, but her soul is happy and her spirit is happy. Here we have a 44-year-old, beautiful, gorgeous woman, charming young lady who had undergone 3 radiofrequency sessions with the hope that these excessive skins and folds will shrink. However, after you look further, you will see and you stretch out that these are how her labia minora appear. And more importantly, this is how her chin and her perineum looked. In short, with her legs spread apart, this is how the vulvar, her external genitalia, appeared. She underwent a vaginoplasty, labioplasty, and excessive prepuce removal. 5 days post-operatively, you will see all these pictures, okay, in sequence. 5 days after, 30 days post-operatively, and 60 days post-operatively with 1 session of RF after 60 days. This is a typical whole intimate makeover. What about that vaginoplasty? Only those women who complain of vulvar laxity or stress urinary incontinence upon laughing, sneezing, or those who feel that their vagina are loose and experience less sexual intimacy, they undergo a vaginoplasty that is addressing the internal external diameters. So the vaginal repair, okay, is vaginoplasty. It is both a corrective and a cosmetic procedure. Corrective because it addresses your vulvar and your vulvar and your vaginal looseness, and a cosmetic because it provides you the basic structures aesthetically. Again, another procedure, another thing, 6 weeks post-op. So, what are the testimonies? Here we have that 38-year-old woman, 3 pregnancies. Remember what I told you? If you looked at this picture, you would say, yan lang, she only came for that. But what did she want? She wanted to be happy, and she heard of the new procedure. So she had a vaginoplasty. She was an extremely satisfied woman. This is immediately after, and this is now how it appears 6 weeks after. What does she have to say? I did it for myself. My husband is happy because I am happy. I feel good all over. Women deserve to feel good. I will recommend this to every woman. That is happiness. Another one is what I call my masterpiece, because this woman had everything. She had all the intimate dysfunctions, from aging, functional to aesthetic. And this was taken almost a decade ago. A 62-year-old woman, so beautiful, 2 pregnancies, who just wanted to do something for herself. And I was surprised, this is how her intimate face looked. She wanted to do something because she felt she was no longer embarrassed to face her husband. She wanted to improve her self-esteem and her self-love. So this is how it looked pre-operatively. Immediately after the operation, it looked youthful. By some miraculous act, I myself was surprised that it became youthful. And 6 weeks after, it even became more functional and aesthetically pleasing to the eye. What did she have to say? I should have done this earlier. So there, my friends, is the science of the most intimate makeover. I gave you a glimpse of how it is to have that opportunity for change, physical appearance, a perceived defect, the look and the function, just to enhance self-esteem. But I need to make you understand, okay, importantly, all this will lead to your intimate wellness and happiness. But there is a secret. The secret is you. What is the secret to be happy? The first step is to have a good relationship with your V. Learn to know your V. Tonight, look and get a mirror and see how your intimate V looks like. Be bold. Look and assess what you've got. Do not be afraid, and more so, do not be embarrassed. The second secret to be happy, if you have perceived abnormalities, forgive yourself. There is nothing in what you did or did not do that caused this abnormality. Changes are part of life. You either accept it, that was given to you, or you seek help when it starts affecting your wellness and your happiness. Thirdly, the secret to be happy is to have patience with all things, but first be patient with yourself. Remembering that self-growth is tender, it's on holy ground. You have to give yourself time to grow with the changes and learn what's causing the changes in your body. There is no greater investment but to be patient. Fourth, always remember to consider yourself first and foremost when it comes to your V's. Your intimate V's do not belong to your partner, to your sister, to your mother. You have to have a relationship with it. You need to take care of it. You need to fall in love to be able to take care of yourself. If it doesn't feel right, then practice saying yes. Then discover what the issue is. Falling in love with self is not mental selfishness, but a heartfelt empowerment. Fourth, as Lucille Ball will say, love yourself first and everything else will fall into line. You have to love yourself to get anything done in this world. Focus on your two V's that are good vulvar care and optimum vaginal health. There is no permanent treatment. You must take into consideration your age, your habits, your sexual behavior, your socioeconomic status, and especially your willingness to look good and to feel good. And lastly, not all women are the same, but each one is unique. My advice to you is to know yourself. We are all different, and that's why we are all beautiful. Happiness is like any aspect of wellness. I will repeat. Happiness is a constant work in progress. But no matter whatever your current state of happiness is now, there's always a way to boost your outlook and give your mental, physical health and wellness a lift. And lastly, a word from our elderly, the secrets of Asian longevity, the latest science, how to live longer, healthier and happier. This is what she has to say. Are you experiencing any issues down there? Are dryness, incontinence, or looseness stopping you from leading a normal life or enjoying your favorite physical activities? You are not alone. At least 50% of all women suffer from at least one form of intimate dysfunction. Remember that V-Restore, okay, that is medical, non-surgical, surgical, promises relief from pain and discomfort. With V-Restore, you can once again go back to your old routine and enjoy your favorite physical habits. Remember, V-Restore is the science and the solution to your most intimate dysfunction. It is safe and will provide a life-altering choice that is not meant to fill, it was meant to fill a gap, but it is not being promised youth, but merely trying to approximately. Thank you everyone for listening. If you want a copy or download this, you can go through the Aherrera Wellness Group YouTube channel. I would like you to follow me and like. My Facebook page now has been changed to Dr. A.D. Aherrera, ADA, and my Instagram account is now Dr. A.D. Aherrera. So thank you once again. I will now end my show and stop sharing. Okay, let me see, where am I? I can now open the floors to if there are any questions or comments. Any questions, comments? Okay. None? I'm sorry, I think I nag-over na ako ng almost 30 minutes. Sorry for that. And sorry for the glitches. No comments, no questions? If not, are we going to call it a day? Are you sure? There is no time for being embarrassed now or anything. Just let me know how I can help you. I
Hi,
will provide this.
Doctor.
Oh,
Hi, Doctor.
yes,
I have a question. Isn't it that if you have an infection, for example, in the vagina, no, or there is a dividing wall, there's a line, a wall that divides that one from the urinary tract, right? Now, if you got infected on the vaginal part, and then you have a urinalysis, will that reflect on the urinalysis?
correct. Yes, that's a very good question, San. Thank you
Uh-huh.
for that. I should have mentioned that. Correct. When a patient comes for a urinary tract infection based on a urinalysis, it is important that the vaginal canal must be examined and assessed. Correct?
Oh, okay.
Okay?
Uh-huh.
Because vaginal discharges that are not disclosed or do not appear in your underwear, okay, may still be thriving inside the vaginal canal. And remember the vaginal canal, I'm sorry, picture it in your mind, the canal, it's a closed tube. So if your vaginal discharges are there, your urinary opening is found in that midline structure. It can also, the discharge can also affect that urinary opening and thereby may cause an infection by giving you symptoms of urinary frequency, painful urination, okay? So that will manifest in your urinalysis, in your urine results. So it is important, basta you have complaints of UTI, the vagina has to be examined for discharges.
Okay.
Thank you. Okay,
Thank
that's
you,
very
thank you,
good.
thank
That's
you.
very good. Yeah, thank you. Any other questions? Huwag na kayo mahiya. Okay, I guess if there are no other questions, oh, sorry, okay. Did you raise your hand, Shirley?
Yes, Doctora.
Yes, hi.
Yes, good afternoon,
Good
Doctora.
afternoon.
That was a nice lecture, and I just want to ask, how much is the virus store?
It depends on what procedure. It depends on what procedure. Remember what I said, the first line of treatment is medical. So that's not going to be costly. You just need a consultation. Okay, the other is the non-surgical restorative procedure, which is your radio
Termy.
frequency. Yeah,
Oh,
the thermy. Yes, that is quite, well, I have no choice but to announce it that because of the probe, which is a one-time use, and the supplier has been increasing their price, the price now of the thermi session has increased. It used to be 20,000 per session. Now it has increased to 30 because of the probe.
Okay.
Okay. Now, with regards to your other surgical procedures, labioplasty, excess prepuce, that is actually I need to assess, evaluate, and to see, because we have to see what procedures have to be done. We have to know what is best for you, what actually you need, not what you want. And the procedures will entail hospital charges along with the anesthesia and the surgical fees. So,
Okay.
okay, so that has to be, we have to examine.
Yes, I might be endorsing that to some friends of mine who
Oh,
might be interested.
okay. But
So the,
basically, yeah, I just want to know if there that you understand that these changes actually happen in time, that not all women will have these problems. It is still important to individualize and to customize whatever treatment is needed for each one. Each woman has a story to tell, and the vulva really is the number one storyteller.
I got it, Doc.
Okay, thank you. Okay, so if there are no other questions, therefore, I'd like to call it a day. And thank you, everyone. I'd like to